Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone. Today we're going to talk about Diprospan, also known as betamethasone. We will learn how to use it correctly and safe. Diprospan is a widely used medication to treat various inflammatory and allergic conditions. It is frequently prescribed for problems such as arthritis, asthma, and some skin diseases. It can also be helpful for severe allergies and autoimmune diseases. So how does it work? Diprospan contains betamethasone, a type of corticosteroid. This medicine works by reducing inflammation and calming down the body's immune response. Simply put, it reduces swelling, redness, and pain that come with many conditions. Now let's talk about dosage. It is extremely important to follow your doctor's instructions very carefully. Generally, it is started with a high dose to control symptoms quickly and then gradually reduced. It can be given by intramuscular injection, and the exact amount will depend on the condition being treated. Like any medication, Diprospan can have side effects. Some of the most common ones include weight gain, bloating, and mood swings. It is important to tell your doctor if you notice any negative effects. Also, do not use it for a long time without medical supervision, as it can cause serious complications. In short, Diprospan is a powerful medication that can be very helpful for many inflammatory and allergic conditions. But remember, always consult with your doctor before using it and follow their instructions carefully. Take good care of yourself, and see you in the next video.
If you've made it this far, let us know in the comments why you're using this medicine.